I call Clive Lewis to move the motion.
Thank you, Mr. Chair. I beg to move that this House has considered healthcare provision in the East of England. Good. Thank you. Good. Very good. Thank you. It's an honour to conduct this debate with you in the chair, Mr. Chope. Before getting into the meat of this debate title, I wanted to give a brief overview of the broad context within which this particular debate sits. The beating heart of healthcare provision in this country is, of course, the national healthcare system. Arguably the closest thing to socialism this country has ever seen, based, as it is, on the provision of healthcare by need and not the size of your wallet. That's pretty unique, not just in this country, but around the world. This far-sighted policy has, one could argue, changed the very nature of our everyday reality. Our health is everything. Without it, we are more insecure, less productive, less happy. The security of good health and access to care, free at the point of use, has revolutionized our society, helping us live longer, more secure lives, and arguably created a social stability affecting economic productivity and perhaps even the strength of our democracy itself. Or at least it did, until around 60 years ago, when it began to be picked apart. Indeed, I would happily give way to the honourable gentleman.
My honourable friend, as well as honourable gentleman, for giving way, and how wonderful it is to see so many people here at the beginning of term, as it were, for this debate. I just wanted to gently point out that the NHS has thrived under successive Conservative governments as well, and although it may be a great socialist idea, I believe it's come to be part of the fabric of our whole country, which I think all parties here want to improve and support. The point I wanted to make was that it's a point not often made. Would you agree with me that the NHS also underpins our enterprise economy? In America and places, it's quite difficult to start a company when you have to think about the healthcare cost of your staff. Here, by underwriting that cost, we help entrepreneurs to start businesses, which is a point often overlooked.
I thank the honourable gentleman for his intervention. The first thing I'll say on his first point, yes, successive governments have presided over the NHS, but with differing intentions. And I think up until let's say the mid-1970s, there was a broad consensus on what I will later come on to, on what the welfare state was and how it would operate. That has changed substantially in the last 60 years, and the implementation of different policies by different governments, including Conservative governments, haven't always been in the best interest of the NHS. As regards to his issue on enterprise, yes, I would say that a secure welfare state, good social security, the ability to give people good health, and the NHS has been integral to that, will have implications on our economy, as I have already pointed out. So, indeed, I'm sure I'm not the first or the last to suspect a direct connection between the rise of angry, anti-democratic right-wing politics and the demise of the NHS's ability to look after us all effectively. So the sheer far-reaching impact of the NHS and its crisis cannot be underestimated. One need only look at the US, as my honourable friend just mentioned, where free universal healthcare doesn't exist, and the state of politics, crime, drug addiction, and social breakdown that takes place over there. One where the free market in healthcare provision and medicines has led to a country with one of the least efficient and high-cost healthcare systems in the Western world, and one where millions are hooked on the heavily advertised drugs as if they were cans of Coke. But let's not indulge too much in English exceptionalism. We need only look at the dentistry and adult social care in this country to see what happens to healthcare provision which, to all intensive purposes, are privatised or well on their way to being so, the consequences of which I hope colleagues in this room will discuss later on in the debate. Thus, the foresight of the 1945 Labour government cannot be underestimated. But when the NHS was launched in 1948, it was done so in tandem with the advent of the welfare state. Because Beveridge, Keynes and Bevan understood the three pillars necessary for a healthy nation. The first pillar of the NHS would be there for you if you became sick. But it was the second and third pillars that meant the NHS wouldn't be overburdened and would work in tandem with them to prevent sickness. The second pillar was, of course, the welfare state, ensuring a network of social institutions that will protect citizens from the market risks associated with unemployment, accidents, and old age. The third pillar was an economic system that prioritised full employment in secure, well-paid, unionised jobs, and one that sought to reduce all forms of inequalities, from wealth to health. But over the last 60 years, these three pillars have been systematically smashed, with the second and third pillars in literal tatters, and the first, the NHS, wobbling precariously. It is therefore testament to the enduring nature of the national healthcare system that it has managed to survive as an almost solitary pillar for as long as it has. So, if a Labour government is to truly fix the foundations of our broken healthcare system, then it must acknowledge the nature of the three-pillar foundations and acknowledge that the NHS cannot be fixed if we don't rebuild and replace the other two as well. So, now on to the Eastern region. From dentistry deserts to skyrocketing rates of mental health referrals and some of the worst ambulance waiting times in the country, this is beyond one malfunctioning organisation. Norwich and the wider East of England region is experiencing a systemic crisis, institutional, social and economic. Healthcare reforms like devolution through to the integrated care boards have become about devolving who gets to wield the axe to make savings, known to many other people as cuts. An example, our own ICB in the Eastern region, part of the NHS Norfolk and Waveney, has been told by national health bosses to cut its running costs by 30% by 2026. So my first question to the Minister is, how would our government deliver improved healthcare outcomes while simultaneously implementing the last government's, frankly, destructive cuts? We know vast areas are largely privatised with spiralling costs like dentistry and social care, undermining the NHS central commitment to free at the point of use and care. Tendrils of the crisis extend into social care. It's often said when you cut social care, the NHS bleeds too. Norfolk County Council acknowledges a crisis in social care. In Norfolk, with soaring demand, struggles to recruit staff, a backload of hundreds of vulnerable people waiting to get their care needs assessed, and care providers folding on a regular basis. So my second question to the Minister is, what news can they give us on the government's unimplemented cap on care, the last government's unimplemented cap on care costs? Is it being implemented, as the Secretary of State implied during the general election, or is it being dropped? And if so, what plans are there to help those facing ruin for their own complex care needs? One of the consequences is in Norfolk, there are regularly hundreds of hospital patients medically fit to leave, but unable to be discharged. And whilst it's clear our healthcare system is struggling to respond to the crisis of today, it's also unprepared for the challenges of the future. East Anglia is the UK region's most at risk from early climate impacts, and there's clear evidence of the links between climate breakdown and ill health. An example, between 2022 and 2023, the number of flood reports in Norfolk doubled. Stretches of Norwich are predicted to flood year after year. Victims of flooding in the UK are 9 times more likely to experience long-term mental health issues, and flooding is linked to a greater instance of respiratory diseases from dampness. Prevention is therefore better than cure, treating the causes, not just symptom alleviation. So my third question to the Minister is, we know the Prime Minister is keen on the so-called preventative state. We've seen some early policy announcements, but can the Minister elaborate a little bit more on what this will look like? What does healthcare provision in the east of England look like, which prioritises prevention? I will give way to the honourable gentleman.
Norwich South for bringing this forward. And I know the debate is about his particular constituency. The issues that he's expressed, Mr Chairman, are issues that are apparent to all of us across the United Kingdom of Great Britain and Northern Ireland. In particular, does the honourable gentleman understand and agree perhaps that maybe one of the things that the Minister could look at and government could look at would be pharmacies having a bigger role in minor ailments. Secondly, the issue of GP appointments and how people, and elderly people in particular, can access those on a regular basis. And thirdly, when it comes to cataract surgery, there's a postcode lottery for cataract surgery across the whole of the United Kingdom. Get it early and you stop people losing their sight. Is he experiencing those similar issues in his constituency as I am in mine?
Yes.
I thank the Honourable Gentleman for his input, and the points have been well made. One of the things I did when researching today's debate was I spent probably more time working out what I didn't have time to say than what I could actually put into the debate. And so what I've tried to do is a broad overview. Many of the issues you've raised are also of concern in my constituency in Norwich South and across the eastern region. And what I would say to the Honourable Gentleman is that during this debate today, I'm sure many of those issues will be raised and dealt with in more detail. So if I can come back, I will start from the point where prevention is therefore better than cure. And so my third question to the Minister is, we know, oh, I said that bit, sorry, excuse me. Damn intervention. So our government has said, I'll come to the fourth question in a minute, Mr. Chair. Our government has said it is a government of service. But a legitimate fourth question I'd like to ask the Minister is, in service of whom and to what end? It's clear to many the interests of big business, big tech and data companies and private finance do not always sit well with the public interest, particularly when it comes to health. There are areas where it does, but there are also areas where it doesn't. We know to whom the last government sided with. Whom will ours back when push comes to shove? Big business, big tech, finance industry, or Joe Public? So, Mr. Chair, I want to briefly now go through a snapshot of the scale of the crisis in the eastern region. Ambulance response times in the east of England are significantly worse than the rest of England. In 2023, response times for Category 1, those are severe cases, was nearly 12 minutes in East Anglia. The national target is 7 minutes. This was nearly the worst on record. The Care Quality Commission itself, now under inquiry and investigation for its own capability to do its job, has described Norwich University Hospital as the worst in the east of England for ambulance times. Referrals to mental health services increased by 18% between 2018 and 2020. Compared to the rest of England, Norwich and Norfolk have higher rates of self-harm, death by suicide, or mental health issues among young people and more self-diagnosed mental health issues generally. Our Mental Health Trust, the Norfolk and Suffolk Foundation Trust, is notorious for being the worst in the country. I will say that again. Our Mental Health Trust in the east of England is notorious for being the worst in the country. I don't think that can be said enough, really. Norwich is a dental desert. In July, the now Secretary of State branded Norwich North the Sahara of dental deserts, a rather romantic notion, but a desert where people pull their own teeth out in a burgeoning phenomenon of a DIY, do-it-yourself dentistry industry. Indeed, some of my Ukrainian constituents have told me that they find it preferable to dodge Russian missiles and artillery to use Ukrainian dentists, which arguably has a better dental system in the middle of a prolonged war. Unsurprising, given that in the East we have one NHS dentist, no, it's not even an NHS dentist, it's one dentist per 2,600 people. And just picture that in your head, if you will. One dentist with their tools waiting for 2,600 people queued up. I think that's what it feels like to many of my constituents. For the second year running, there are no dental practices accepting NHS patients. Norfolk children under 5 have some of the worst tooth decay in the entire country. Thousands of people have had to go to hospitals in Norwich and Norfolk for abscesses that should have been prevented. The list goes on and on and on. And I'm sure many of my colleagues here in the Eastern region will also outline some of the issues and the stories that they know are taking place on a daily basis and have been for many years now. I will give way.
Very grateful for giving way and making the point about dentistry, which I think all of us have seen, particularly in these. Does you agree with me that the real cause of this is threefold? The tariff didn't keep up with costs and inflation. We haven't been training enough dentists and we've been losing too many, and that the previous government's dental plan was a big step in the right direction. Does he support that plan? And I'd be interested to know whether the opposition intend to continue to implement it.
I thank my honourable friend for his intervention. I'll leave that response to the Minister because it's a question that she would better be able to answer. But I think, frankly, given that the last government had 14 years to sort that mess out and has handed that mess pretty much complete over to the new Labour administration, I won't be singing the praises of the last government when it comes to dentistry, unfortunately, and that won't be going on the record. So, Mr. Chope, I'd like to kind of conclude by looking at the social and economic roots of the healthcare crisis. It's the elephant in the room. But as I've already outlined, many of these causes of ill health are socially determined. Waiting lists, ill health, mental health, these are signs our healthcare system is breaking down. But also that we have an economy with a degrading social fabric. One only need look at the race riots this summer to understand that. But don't take my word. Listen to civil society organisations in my constituency that are at the coalface of this crisis. Norfolk Care Association, they say around 10% of health outcomes result directly from healthcare delivery, with a more significant proportion derived from the physical, social, and economic factors that people experience day to day. The government must do more to tackle poverty, ensure quality housing, and create safe communities as they are fundamental to improving health outcomes. Norwich Age UK said the key issue with healthcare facing older people is chronic health conditions and limited spend on prevention. Around 55% of Norfolk's older population have one or more long-term health conditions. However, most are treated independently. They ask for rebalancing healthcare focus and investment to underlying causal factors, the wider determinants which make up 80% of a person's overall health status. Let's have some more. Let's have a quick look at some more drivers of ill health. Let's take, for example, fuel poverty. 10% of people in the east of England live in fuel poverty. It's almost 12% in Norwich South. Fuel costs in the UK are on average 30% higher than the EU average. I will give way on that point.
He makes a very important point about fuel poverty and its direct link with illness. So will he be supporting his government's removal of the winter fuel allowance?
I thank my honourable friend for his interesting question. I am not happy with the removal of the winter fuel payment. Of course I'm not. I don't think anyone on this side of the House will be happy with that. But I also do understand there are 2 points in the year you support your government, the King's Speech and the budget. I'm not looking to break that. However, like many of my colleagues, I think I have severe concerns about the impact this will have on people's health and well-being and their pockets. And I have every confidence that my government will put in place the best possible response it can to the £22 billion hole left by the members opposite. I just don't think winter fuel payment allowance is necessarily the right way forward, but we shall see what happens in the coming days, weeks ahead. So my next question to the Minister, so does the Minister believe, it's almost preempting yours, that the cut to winter fuel payments will improve the situation of fuel poverty and its impact on health? Another example, financial insecurity. Norwich Age UK has told us that 35% of Norwich wards fall within the top 10% of the most deprived areas in England, with a 35% rise in food bank use in the city and fuel poverty at nearly 16%. 68% of Age UK Norwich inquiries were about money, debt or bills. Another example, poor housing, malnutrition. This is the time we have malnutrition in Norwich to some quite extreme levels. Norfolk has the highest malnutrition rate in England. 1 in 5 people in Norfolk and Waveney, as Jade Hunter, in Norfolk and Waveney. Jade Hunter, the head teacher at West Erdham Infant and Nursery School, told The Guardian, "We do get a lot of bad chest because they're in damp homes that are maybe mouldy, and we get a lot of sickness and diarrhea because the quality of the food they're eating isn't great." This is the same head teacher who told me that one of the ways they know children are hungry is that they watch them chew their pens and chew sand, because that shows them that they are not being given what they need to be able to thrive at school. So I'm going to conclude to allow others to contribute to this debate, but before I do, Mr. Chope, I would like to ask a couple more questions of the Minister. We know that there's going to be a government review of NHS England structures. There is an incomprehensible patchwork of bodies covering different geographical areas: Norfolk and Suffolk, NHS Foundation Trust, East of England Ambulance Service, Norfolk and Waveney ICB, the list goes on. Do we have any plans to simplify those structures, make them more accountable? I understand that NHS reorganisations and reforms are not always very popular, particularly with staff, but it's a question I'd like to ask. The second question is, before the general election, all of the Norfolk MPs called for an undergraduate dental school to be established at the University of East Anglia. And I know that myself and my honourable friend from Norwich North and many others across the region have been working towards that end. Could the Minister tell us a bit more on whether there's any news or developments on that? Because we know that will be critical to beginning to end the dental desert in Norfolk and Waveney. And I would also mention Suffolk as well, which is almost in as bad a state when it comes to dentist provision. And my final question is on mental health. This is something that I've campaigned for before I was an MP and continue to campaign on to this very day, despite the difficulties, despite the last 15 years of so-called change and reform in our mental health service. It is still arguably the worst mental health service in the country. So will the Minister answer the question as to will there be a statutory public inquiry into the systemic failure of mental health services in Norfolk and Suffolk? This is a scandal, a slow-motion disaster that has gone on for too long, disrupted too many lives, ruined lives, seen people die unnecessarily, much grief. People need answers, and if we're to learn lessons from what's happened the last 15 years, then we do need an independent public inquiry to get to the bottom of it. And with that, Mr. Chair, I will conclude my remarks for now.
The question is that this House has considered healthcare provision in the East of England. Before calling the first speaker, can I say that there are about 10 people who have indicated that they wish to speak in this debate. The wind-ups will start just before 20 to 11. I believe in self-regulation, but I hope that people will be able to contain themselves so that their speeches meet the overall needs. Jerome Mayhew.
Thank you very much, Mr. Chape, and I congratulate my neighbour for securing this important debate about the health service in the East of England. We've just recovered from a general election. I hope we've all had a time off, a bit of a break to recharge our batteries and to start thinking about the way in which we should lead this country in the years and months ahead. Health and the health service was a key election issue on the doorsteps in Broadwood and Platinum. And as the Conservative candidate, I was armed with a whole series of data about how we had more doctors, 20,000 more doctors, we'd recruited more nurses, I think it was 50,000 more nurses. We'd paid for and secured more appointments for GPs, 50 million more appointments each year, to 350 million GP appointments per year. And we provided more funding, a lot more funding for the NHS. So we'd increased it by £28 billion, a 17% increase since 2019. And so I'd have a conversation on the doorstep saying, reeling off all these facts about how we'd improved or funded the health service. But it didn't feel like that to our constituents. And it was a key negative impact for the Conservative candidates like myself. So you've got to ask yourself, why? Why is it when as a government we felt we'd done what we could, we'd improved, increased the numbers, increased the funding, and yet the outcomes that our constituents actually experienced did not tally up? Well, there are a number of factors that I've come up with. One was the COVID backlog for elective surgery. And that's something which was thrown at the government, obviously caught unawares back in the early part of 2020, and it created a huge backlog. Now, steps were taken to address it. In Norfolk, we have the new operating theatres, 2 new operating theatres at the Norfolk and Norwich for elective surgery. We've got the diagnostic centres at the James Paget and the QEH, and a new one at Cromer as well. But they take time to work through, and the election came before our constituents felt the benefits of that enormous local investment. But there was a bigger problem, and that is one that my government failed to address. I think it's a key proper criticism of our government, was that productivity in the health service went down between 2019 and 2024 by about 5.8%. So we're putting much more money in, we had more staff, and yet the outcome, what they were achieving, decreased. And if there's one thing that the Minister should be addressing, and I'd be very grateful if she could address this directly in her summing up, is what plans the government has to improve productivity, not just funding, not staffing, but productivity within the NHS, because that is the absolute key. And my starter for 10 is it won't be by having pay deals like that awarded to ASLEF, where money was provided and the productivity improvements were removed from the deal. Yes, I will give you.
I'm very grateful to giving way. He makes a really important point about productivity in the health system. Does he agree with me? And I've been a health minister, and I've observed that in the health system, not by ministerial diktat, just the way it works, if you deliver more for less, the Treasury and Department of Health give you less, and if you struggle to deliver more for less, we give you more. If you ran a business like that, you'd be bust. Does he agree with me that ultimately the East needs a much more decentralised, empowered system? In Norfolk, we have an ambulance trust, a mental health trust, 3 hospital trusts, we have 5 CCGs. This is bonkers. We need surely one Norfolk healthcare system that provides what patients need, an integrated patient pathway.
I'm very grateful for that intervention. We have got progress in this direction with the Integrated Care Board. I personally think it's a very good step in the right direction, because it allows Norfolk, the whole of the care system in Norfolk, to come under one remit. And we were beginning to see some, in my view, some of the benefits of that with the Mental Health Trust. So that, although it has got a long and pretty disgraceful history of underperformance, there are some tentative signs of improvement since the ICB has come into power. The next issue, particularly in Norfolk, was the physical state of our hospitals. So we have the Queen Elizabeth Hospital, the QEH at King's Inn. It's a RAC hospital, the James Paget in Yarmouth, and then a pretty modern hospital, actually, the Norfolk and Norwich in Norwich. The last government fully funded, agreed full rebuilds of the QEH and the James Paget. They are long overdue, those rebuilds. They're going to be rebuilt by 2030. I am very, very concerned to hear that that funding commitment is now under review. And the Minister may be constrained in what she can say at the dispatch box, but whatever reassurance she can give the residents of Norfolk about the intention, at least, of the current government to continue those rebuilds, it would be very much appreciated, because they are enormously important to my constituents. And then there's dentistry. So the Honourable Member for Norwich South talked about the dental desert that we have in Norfolk. We have 39 dentists per 100,000 of the population, compared to a national average of 52. If you grow up in Norfolk and you want to be a dentist, the nearest place you can train is Birmingham or London. So it's not surprising that we don't have domestic, homegrown talent coming up and being dentists in Norfolk. And if you're a 26 or 7-year-old who's just qualified and you're not from the Eastern region, what incentive is there for you to move to a largely rural area? It's for those reasons that we desperately need a dental training, an undergraduate dental training school based out of the UEA in Norwich, but perhaps in partnership with other academic establishments in the east of England. I'm not squeamish about what it looks like, but we do need to have undergraduates being trained in the east of England and in Norwich, because we know from the medical school that we have at the UEA that about 40% of the graduates become sticky. They stay in the area because they fall in love, get married, and develop commercial relationships with GP surgeries and the like. So at the last government, we had the dental minister up at the UEA in about May, I think it was, for a lecture and a series of meetings. The impression given was that we were on the cusp of an announcement of a dental training school, but that the election came in the way. All of the Eastern Region members of Parliament, irrespective of their colour, are wholly in support of this, and it would be very grateful if we could have some indication, as the Honourable Member from Norwich South said, that this is still on track. So there's a huge amount to be done in the east of England, and Norwich in particular, but we have great staff, we've got good structures, but we just need to get the productivity working, and we need to get the expectation of early appointments with GPs back on schedule. One of the recurrent complaints I get from constituents is that how difficult it is to see a GP. I note that 43% of all GP appointments are now on the same day, and that is a record that needs to be built on. So I listed a number of areas where I'd be grateful if the Minister could give an indication. I look forward to hearing her response.
Yes, Asante.
Thank you to my honourable friend, for the member for Norwich South, for securing a debate on such an important issue that I know is close to the heart of all of our constituents. The NHS is clearly in crisis. Those who can afford to go private do so, whilst everyone else is forced to linger on long waiting lists. My residents are frustrated, sometimes to the point of giving up, with waiting for urgent operations and sometimes just to get a GP appointment. In my constituency, Lowestoft Hospital was closed a decade ago. The building now lies empty, without a replacement, and we continue to wait for a long-term solution which benefits the community. And has already been mentioned, the James Paget Hospital's rebuild is desperately needed. It is one of the 2 worst affected hospitals for RAC in the country. It seems clear that the crisis in the NHS is no longer just an issue of funding, and that investment must be coupled with reform in order to fundamentally improve health outcomes. I have been impressed, for example, by East Coast Community Healthcare, a staff-owned social enterprise that provides community-based NHS healthcare across Norfolk and Suffolk. EC demonstrates how things can be done differently and how technical solutions and the freedom to innovate can allow providers to do more with the same funding and operate a system that is able to absorb rises in demand. We sorely need to improve people's experiences of NHS care. For many, it has become something of a nightmare. I'd like to focus, if I may, on dental health. My constituents are particularly concerned about their inability to access NHS dentistry, and rightly so. Over the past 14 years, as we've heard, areas like mine have become so-called dental deserts. As it stands, East Suffolk ranks 7th out of the 39 districts in the east of England for the lowest number of dentists. Where dentists are practising, residents find it impossible to get an appointment. In 2022, it was found that not a single dental practice in Suffolk was accepting new NHS patients. I've met and talked to far too many of my constituents who've been forced to rip out their own teeth, as we've already heard, is happening right across the east of Anglia. And that's precisely why I made improving access to dentistry one of my 6 pledges during the election. And though some progress has been made by the formation of the Norfolk and Waveney Integrated Care Board, it seems clear that it is the dental system itself which is holding the NHS back from making improvements to its accessibility. We have at the moment a system that doesn't work for patients and doesn't work for dentists. A survey by the Dental Defence Union of its members found that 41% are looking to reduce their hours, and 31% are planning to leave practice or retire early because of the sheer pressures of the system. As NHS dentistry crumbles, I'm particularly concerned about the impact it's having on our children and young people. Data shows that almost a third of the 100,000 people that are admitted to A&E with tooth decay each year are children. It's the most common reason for children aged 6 to 10 to be admitted to hospital. Analysis from the British Dental Association has found that on average 116 children had to have their teeth extracted each day in 2022. In that same year, it was revealed that 40% of children, that's 4.4 million children, had not seen a dentist in the previous 12 months. This is clearly an issue of inequality. Children from disadvantaged backgrounds suffer from worse oral health than their more affluent counterparts. It's a significant gap. 34.3% of children from deprived areas had dental decay in 2019, compared to 13.7% in less deprived areas. Poor health contributes to poor life outcomes. For example, teacher surveys have shown how poor oral health contributes to social exclusion that leads to children missing school. Breaking that vicious cycle is essential. If we can't improve people's health, how can we improve their lives? Instead of ensuring children get the best start possible in life, we're handing them rotten teeth and rotten chances to succeed. So I'm glad that this government has firmly set its sights on revolutionising dentistry in this country. Rebuilding NHS dentistry is going to be a difficult job, but unlike the last government, this Labour government won't kick the can down the road. I'm delighted that we've said we'll create an extra 700,000 urgent and emergency dental appointments each year, including 100,000 for children. I welcome the financial incentives for new dentistry graduates to work in dental deserts like mine. We'll ingrain the importance of good dental health practice in children from a young age and crack down on the prevalence of hospital admissions for rotten teeth by introducing supervised toothbrushing for 3 to 5-year-olds in schools. And most importantly, we'll reform the dental contract, which isn't fit for purpose and pushes dentists into private practice. With an active government, a government willing to attack issues at the root, sorry for the pun, I'm confident that we can make significant progress in this and all other areas of healthcare. Ultimately, the NHS is the form in which most people interact with the government. If we can rebuild trust there by delivering improvements, then we can also rebuild trust in politics and the ability of the government to improve lives. And if we can get the basics right, then all the other issues become easier to solve. Thank you.
Eva Halings.
Thank you.
I think you must stand up.
Thank you very much. In my constituency of South Cambridgeshire, we're witnessing the tragic consequences of an outdated funding formula. And this is entrenching deep inequality across the region and across the country, but it's particularly deep in Cambridgeshire, which is the most impacted of all 42 healthcare systems in the country. And we are receiving the lowest amount of healthcare funding per person for primary healthcare. And this is just wrong. And a distressing example of this is happening right now in South Cambridgeshire, which is one of the fastest growing places in the country, where GPs, we've talked about productivity, GPs are treating more patients than ever before, but cannot keep up with the demand of a growing population, and in particular, this is because of the funding formula. My survey during the campaign showed that 60% of those responding to the survey were struggling to access a GP appointment. And we've heard that this is happening across the region and across the country. But this has come to a head, Mr. Speaker and Chair, by this week, the tragic handing back of the GP contract by 4 much respected family GPs, because it is impossible for them to continue, financially impossible for them to continue. They are devastated by this decision. I've spoken with the Integrated Care Board, which has been unable to stop this happening. And my constituents in Fulbourn, Fenditton, Marley, Cherry Hinton, as you can imagine, are hugely concerned. This is a direct consequence of the Carr-Hill funding formula, an outdated funding formula that does not take into account deprivation in an area. Therefore, those practices which are dealing with deprivation find themselves dealing with more patients than others and more complex needs than others. But the funding formula does not take this into account. And the practice has tried to deal with this over the years, and in the end, this is the tragic consequence. Will the Minister join the Royal College of General Practitioners, the NHS Confederation of Primary Care Networks, the Cambridgeshire and Peterborough Integrated Care Board, and myself in calling for the radical review of this outdated Carr-Hill funding formula so that we can actually enable GPs to do their job well and sufficiently? Thank you very much.
Sam Carling.
Hearing this important debate this morning. Following the election, some of the earliest emails I received were from NHS staff in a variety of disciplines who feel deeply undervalued, underappreciated and overworked. In May of this year, GPs in Cambridgeshire, as an example, carried out 547,804 appointments, 62.5% of which were face-to-face. That is the equivalent of 64% of the county in just 1 month. There are more patients per fully qualified GP in the east of England than England as a whole. That is the same for my region of Cambridgeshire and Peterborough. And in my constituency of North West Cambridgeshire, there are less fully qualified GPs now than there were in 2017. Local practices simply do not have the funding to hire more GPs. So we find ourselves looking at a ridiculous situation wherein we invest as a nation in world-class training for new GPs through 6 years of medical school, and followed by foundation years and beyond. And then once they qualify, they often can't find work. And it isn't just about putting more funding into the system as a whole. Allocation isn't working fairly either. The funding formula, as the Honourable Lady has just mentioned, used for the general medical services contracts under which most GP surgeries operate, is based in part on data from before 2000. And leading GPs that I've spoken to have expressed a firm view that it discriminates not just against some of the areas that the Honourable Lady was mentioning, but against urban settings with younger patients, despite significant health needs in those areas. I represent a significant part of urban Peterborough, which last year was ranked as the least healthy place in the entirety of Britain. This has got to be seriously examined with changes made. GMS contracts are held by practices in perpetuity, but a number have had to hand back their contracts to local NHS commissioners, which leads to their practices being put under time-limited commercial contracts called APMS contracts. This handing back occurs when practices just cannot cope financially anymore, and the rate of this in our region is truly shocking. Nationally, around 1% of GP practices are on APMS contracts. In Cambridgeshire and Peterborough, it is 12.5%. 1%, 12.5%. 1 in 8, with many more on the edge. These contracts are held by private companies whose loyalties lie with their shareholders, and this stealth privatisation of our regional services is an appalling legacy of the last government's 14 years of failure. Not only are these private contracts bad for patients, with continuity of care poorer due to a higher proportion of locum staff employed, but they are also far more expensive for the taxpayer. I know of one example in the region that is being given £40 of additional funding per patient under an APMS contract, when, ironically, even half of that extra funding added to the GMS contract they handed back would probably have solved the problem. And that makes me even more pleased and proud that this new government is taking immediate steps to address the situation, with a 7.4% increase to the global funding sum for GP practices having been announced for 2024 through 25. We will fix this mess, but it is going to take time. And healthcare needs are becoming greater over time. This is particularly acute in the East, the fastest growing region in the UK in the 2010s, where the population grew by 8.1% between 2011 and 2021. Like much of the UK, the East is also ageing. With people living longer, their healthcare needs become more complex and challenging, and a thriving workforce is needed to address those appropriately. Left unattended, NHS England warns of a shortfall of between 260,000 and 360,000 staff by 2036 to 37, with patient demand increasing across the board. And in my maiden speech, I highlighted the dental desert we face in Peterborough, as others have mentioned in their areas, with some people having to travel as far as Stevenage and Kettering to receive treatment. As in our city, there are no adult dental clinics accepting new NHS patients. The British Dental Association has warned that unmet need for NHS dentistry in the UK is at an all-time high, and the government will need our support to bring that down. But of course, healthcare is a joined-up issue, affected by several other policy areas. The crisis in social care, for example, has exacerbated many of the issues faced by the health sector. Some in our eastern region have championed innovative methods to tackle this, such as models using virtual beds, of which there are 190 in Cambridgeshire and Peterborough, and feedback has been really, really positive there. So we need to support that kind of innovation to make our NHS fit for the future, as I know the government will. But the issues in healthcare seem never-ending. Rack-ridden hospitals are having to be replaced. GPs and NHS workers are burnt out. Recruitment and retention are difficult, yet simultaneously some can't find work. Access to dental care is non-existent for some. Healthcare inequalities persist. Patient demand is growing and growing. Dealing with all of this is a huge undertaking, and the government has been left with a terrible inheritance. Addressing it will require a deftness, competency and compassion we haven't seen for 14 years. But the government has started well, and I have every confidence that the East and those in my constituency of North West Cambridgeshire will benefit from this Labour government's approach and see a better experience for staff and patients alike.
Blake Stevenson.
Thank you, Sir Christopher, and thank you to the member for Norwich South for securing this debate. We seem to be on a journey from east to west, so we've covered Norfolk, we've covered Cambridgeshire, and now we're in Bedfordshire, one of the smallest counties in England, and I'm pleased to be joined by my neighbour from Bedford and Kempston here today. We are a small county. We're a very rural constituency squeezed between Bedford and Luton. And if I may, I'd just like to dwell on 3 points: housing growth and primary care, hospital modernisations, and rural communities and health equality. Our communities in mid-Bedfordshire have done more than their fair bit and taken more than their fair share of housing growth. And we've seen population growth far outstrip the delivery of new infrastructure. Nowhere is this more apparent than in a new town called Wixham's in my constituency. A planned new town. Residents have reasonably expected that the infrastructure they need would be staged throughout the development, so that they have the healthcare they need as that community grows. But that has not happened. 17 years after shovels went in the ground, around 5,000 people now call Wixham's home. That number could be as high as 20,000 when the development is finished, but they still do not have a GP surgery. And the community has been fighting for years to have a GP surgery, and their demands have been falling on deaf ears. Between the local authorities, Bedford and Central Bedfordshire, and the ICB. The ICB are not accountable to our local populations, and that demand for GP surgery is falling on deaf ears. And I would ask the Minister, if I may, to respond to that and join me and help me to unblock the issues that we're facing with local, unaccountable, integrated care boards to deliver the healthcare in Wixham's. I know that that case in Wixham's is not an isolated one. Across mid-Bedfordshire, I hear time and again of cases where GP surgery capacity has failed to grow and meet population growth. In our ICB area, and we've heard statistics from colleagues in this room, the average number of patients per GP is now 2,955, up 651 since December 2016, and in the same period, GP numbers have reduced by 44. It just isn't good enough. We need better healthcare for our constituents. And I'm sure that picture is painted in constituencies right across the east of England. If the government is serious about plans to deliver 300,000 new houses per year, it also needs to be serious about its plans to deliver the infrastructure our communities need. Starting with a clear plan for a capital investment programme that will give local communities the funding they need up front to deliver GP surgeries, rather than waiting for developer contributions after the houses are built. So I'd be interested to hear what the Minister says about infrastructure alongside housing development. My second point is on hospital modernisation. Communities across the east of England deserve access to modern and advanced hospitals. I welcome that the previous government had committed to the inclusion of the Cambridge Cancer Hospital and the Milton Keynes Women and Children's Hospital in the new hospitals programme. I'd urge the current government to confirm that they will be proceeding with that investment. But we can't stop there. Right across the east of England, we see hospitals failing to deliver the high-quality services that our constituents need, through no fault of the hard-working doctors and nurses who work there, but because of crumbling buildings and poor technology. In Bedfordshire, we are behind on NHS digitisation, and significant investment is needed in the fabric of our local hospitals, particularly in Bedford, where I understand there is a significant and serious maintenance backlog. In the coming months, I look forward to engaging further with the Minister and the Government's plans to drive forward NHS digitisation in Bedfordshire and discussing how we can ensure people using Bedford Hospital, mostly people in the north of my constituency, have access to the state-of-the-art facilities. My third point is on rural communities and health inequality. Across the east of England, many of us represent highly rural constituencies. I don't think I'm going to out-rural colleagues from Norfolk, but mid-Bedfordshire is among the most rural, and some of our residents face significant health inequalities as a result. Whether that's difficulties in accessing treatment for remote and isolated hamlets, with poor access to health services, insufficient public transport, narrow roads, bad broadband, longer travel times to access the local GP and dentist, indeed if there is a dentist, or the challenges for many of our more rural healthcare settings in recruiting staff. During this Parliament, I would like to see the Government commit to delivering for rural areas with focused efforts to deliver staff and services that reach out into the most isolated communities and ensure that everyone can access the healthcare they need within a short journey from their front door. And I hope that colleagues across the east of England share that ambition. Thank you.
Yeah. So, Owen.
Thank you, Chair, and it's a pleasure to see you in your place today. I'd also like to congratulate my honourable friend from Norwich South for securing this important debate today. And as we've heard in the contributions made by members so far, the levels of disparity in healthcare in the east of England are significant. And in my constituency of Luton North, they are very stark indeed. There are huge gaps in health and life expectancy across the town itself. Not talking about the region, just the town itself. These gaps mean that you can live in one area of Luton and live up to 10 years longer than another part of the town. I am sure honourable friends would agree that for the life expectancy gaps in one town to be so stark in 2024 is shocking. Unfortunately, we know that there is a link between poverty and healthcare outcomes, and indeed healthy life expectancy, which cannot be separated. Luton currently has the second lowest public spend figures in the NHS, local government, police and public health compared to relative towns in need in England. And that is not to be said after the 14 years of austerity that we have also suffered from in Luton. Luton, sadly, has high levels of child poverty, with around 45% of children living in poverty. There seems to be this misconception when we talk about poverty, and child poverty in particular, that we're talking about people not in work. But actually, what I find, and when I see my constituents who are struggling, reliant on voluntary services like the food bank, like the curry kitchen, like the breakfast battery boxes running out of Sundon Park, is that most of these people are actually in employment, working hard and trying to support their families, but unable to make ends meet. And there is one issue in regards to child health that I'd like to focus on, and I know everybody has touched on, and that is access to dentistry. A report on children's oral health published by Luton Borough Council in March last year found that Luton had some of the highest prevalence of tooth decay in 5-year-olds in England. Now, I want to dive into some of the reality behind those stats. I have visited countless primary schools across Luton North, and one of the key things that teachers always raise with me is oral hygiene. I've sadly seen children with brown nubs where white teeth should be, who may have never owned their own toothbrush or have had access to one at home. There are now many schools in Luton North who provide children with toothbrushes to be kept at school and take time out of school to ensure children are brushing their teeth. Most of these children have never seen a dentist before, and many of them require painful tooth extractions, with tooth decay being the most common reason children aged 6 to 10 are hospitalised for tooth decay. We know this has a knock-on effect in children's vital early years of development. They're missing school, unable to speak properly, learn phonics, or eat a proper, healthy and balanced diet. And now there are organisations trying to fill the gap. The Charity Dental Wellness Trust visited Warlords Primary School in my constituency, and it was lovely to see them working there with the 250 children, providing free dental health screenings and fluoride varnishing. And whilst this mechanism to try and plug that gap and target a problem, it's clear we need to have much more joined-up approach to dentistry to improve health and break the cycle of poverty, and to put a child's smile back into our community. And this isn't just about children, adults as well. Every time I knock on the door, I am asked where NHS dentists are available in Luton, and I have to point them outside of the constituency into Harpenden, shockingly. And that is why I am very proud of Labour's Dentistry Rescue Plan, which will currently fill the gap that is currently that we are seeing, with an extra 700,000 urgent dental appointments a year. Reform dental contracts, as we heard, is a problem, to rebuild NHS dentistry to make sure everyone has access to a dentist appointment, and improve incentives for dentistry graduates to work in areas most in need of NHS dentists, places like Luton. When it comes to improving health in our local areas, it is key that we draw on the knowledge of local community leaders, stakeholders and organisations to inform our approach. This is something that I would say is unique and very well done in Luton. An independent review of health inequalities carried out by Pastor Lloyd Denny, a pastor from Luton who has lived in our town and worked with the local communities for years through his faith. This report and review highlighted 4 key areas which needed urgent attention and improvement: communication, access, representation, and cultural competency. Something that we had to lean on during the times of the pandemic. And we saw this in action. We saw this in action with mine and my honourable friend's friend from Bedford's friend, Imam Qazi Chisti, being one of the first of the faith leaders to take the COVID vaccination. Representation, cultural competency, access and communication right there in action. We see this with the Love Luton Run Fest, which is going to be happening. I always get pressured into trying to do the half marathon. Forget it, guys, that's not happening. I'll do 10K max. And we also see it with our PCNs, the E-Equality PCN initiative that's working in our community, that is targeting and working with communities to ensure that people can live healthy lives. Dr. Tahir Mahmood is doing fantastic work with our community. And not to mention, the representation in women's sport that we have in Luton is fantastic. Hina Shafi is one of the most brilliant representatives for women and inclusion in sport. And Dion Manning is another fantastic woman, local hero that we have with women's football, but also trying to keep people like me in shape. There is no doubt that there is brilliant work being done at a local level, but there is undoubtedly still a devastating postcode lottery for people to receive access to cancer care, with a major variation across England in terms of expectancies and outcomes. Something that is very close to my own heart when it comes to cancer care is brain tumours. I have had a number of constituents who have been impacted by this cruel disease, and I have been lucky enough to work closely with Karam and Yasmin, the parents of Amani, who lost her battle with glioblastoma in April 2022, aged just 23 years old. Despite the significant leaps and bounds made in other forms of cancer treatment, which should be welcomed, outcomes for those diagnosed with brain tumour remain extremely poor, with no new treatments developed in the last 20 years. If you are to get brain tumour treatment, it will be exactly the same today as it was 20 years ago. Around 12,000 people are diagnosed with a brain tumour each year, and they remain the largest killer of those under 40. Fewer than 13% of those diagnosed with a brain tumour survive beyond 5 years, compared with an average of 54% across all cancers. And I urge the Minister to continue working with MPs such as myself and the Right Honourable Member from Mitcham and Morden and campaigners on this issue. I also want to take a moment to touch on an area of medical injustice that is particularly painful for a constituent I met just last week. She is a prima DOS baby, meaning her mother was given an oral hormonal pregnancy test, which around 1.5 million women took in the 60s and 70s. And while it was found to be harmful and banned in other countries in 1970, the UK continued to circulate it until 1978. Tragically, the use of these pills resulted in many babies being born with disabilities such as missing limbs, heart defects, and brain damage. Many babies did not survive beyond the womb. Most patients were issued Primados without prescription, meaning that there isn't evidence that they ever took it. My constituent's mother was just handed it to her from the desk drawer of the GP. For others, their medical records were destroyed or lost. We've heard similar stories of medical records going missing suspiciously in the infected blood inquiry, and it's extremely harmful both physically and psychologically for the patients involved. My constituent has suffered from a rare brain tumour due to Primados and continues to suffer from many other health issues as a result. In spite of this, she inspirationally continues to fight in campaign to get recognition and a response from the government for victims like herself and others. Sadly for her and her peers, they are yet to receive any sort of compensation, despite victims of a mass-scale case of medical negligence that has resulted in the painful lives and premature deaths of so many. I'd be grateful if the Minister today could confirm whether she will agree to meet with myself and my constituent to discuss a way forward for those affected by the Primados scandal. Now, I've chosen some very specifics there. It's health inequalities, it's life expectancies, it's how healthy we can live our lives, and then some very acute cases around dentistry and cancer. But I know that our Labour government is committed to shifting the focus of the health systems towards prevention, and that is where we need to see that focus. I'm hopeful that health schemes, such as the ones that we have heard of during the election, can be rolled out across the east of England and indeed across the country to improve things such as cancer care and outcomes for all who are suffering from that cruel disease, and especially to close the deep-rooted health inequalities that we see across our town and our region. Thank you.
Thank you, Ramsey.
Thank you very much, Mr. Chair, and thank you to the Honourable Member for Norwich South for securing this crucial debate today. Our region is a rural region, and many other members have talked about the decline in health services in rural areas, and I want to talk about how that's particularly affecting my constituents in Waveney Valley, which straddles the Norfolk-Suffolk border. Because whether it's the long waiting lists for surgery, whether it's the long delays in getting assessments for mental health, the difficulty in accessing a GP or a dentist, we have seen a decline in our health services and it becoming harder and harder for people in our villages and market towns to access services. And when it comes to the budget in a few weeks' time, I very much hope the government will look at all options for increasing funding to the NHS, including being willing to ask the very richest in society to pay a little bit more in tax, modestly more, in a way that could enable us to get in the funding that's really needed to keep pace with demand. Now, Mr. Chair, I want to raise three specific questions on areas that affect my constituency, particularly in terms of decline of rural health services, and I would appreciate it if the Minister could address those three specific questions when she sums up in a little while. The first one relates to the lack of hospital services in rural constituencies, and others have referred to this already. So, for example, at the Hartismere Hospital in Eye, a wonderful building, and the building itself has had a lot of investment, there's a lack of services there which the local population, particularly the older population and people without a car, would really like to be able to make more use of. The League of Friends at that hospital showed me round the facilities a couple of weeks ago, and the facilities are excellent, and the hospital does run a range of clinics which people really value. But having spoken to the League of Friends and to local doctors, they would like to see facilities like an X-ray scanning unit, the return of a community consultant, particularly in services for older people, a GP walk-in surgery. So my question to the Minister is, will she consider how hospitals in rural areas like the Hartismere Hospital in Eye can be given the resources and support to provide a greater range of services?
Would the right honourable member take an intervention?
Yes, of course.
You talked there about hospital services.
Order.
Thank you. You talk about hospital services, and especially for those who are more elderly in society.
Yes.
Would the right honourable member join me in also calling for more cross-party talks on social care, which is often the back door of actually the support that a lot of people need that are going into hospital?
Thank you very much for that intervention, and I totally agree with your point, and have had family experiences in recent months that have shown me very starkly and first-hand just how much we need to address the social care crisis and its lack of integration with the health service. So I wanted to highlight that on the Norfolk-Suffolk border, in towns like Eye and Diss, people are 20 miles from the nearest big hospital in Norwich or Bury St Edmunds or Ipswich. And in towns like Halesworth, people are even further away, and Halesworth doesn't have a local community hospital at all now. So I would ask the Minister to consider what support can be given to rural hospitals to provide more services, and particularly to encourage cross-county border working in the health services that enable us to look at how services can be provided that benefit communities where those communities straddle the county border, as they do in my constituency around Diss and Eye. Secondly, I wanted to raise the issue of dentistry, and it's no surprise that we've heard that today from nearly every member who's spoken, because we do have the Sahara of dental deserts in the east. I conducted a survey in the winter of residents in Waveney Valley where over 800 people responded, and a quarter had given up on dentistry treatment altogether because of lack of NHS provision. Others are driving very long distances to access a dentist. Some had even pulled out their own teeth. And this is just not tolerable in the 21st century. Now, I welcome the government's commitment to reform the dental contract, and from my discussions with dentists and dental organisations like the British Dental Association, it's been very clear that the reform of the dental contracts is the root cause of the issue, in terms of why we're seeing this big exodus of dentists from the NHS, dentists not being paid appropriately for the work that they're doing. So could the Minister set out the timescale for that contract being reviewed? Because health organisations have said to me that for every work that they put into getting new dentists into the NHS, their dentists are leaving the NHS at a greater rate. So we've got to address the root cause of the problem. And then thirdly, I want to highlight optometry, because I received correspondence from an optometrist in Norfolk who's concerned about the lack of post-operative aftercare, particularly from surgeries like cataract surgery. And they highlighted that privatised companies are operating services like cataracts and then discharging members to the community without the aftercare, and that's having a knock-on effect to A&E. And so the question I'd raise is, can the Minister ensure that when privatised companies are providing these services, that proper aftercare is provided? And will she commit to looking at whether this actually highlights the problem of relying on private companies for providing services who might seek to cut corners in the name of profit? So to conclude, I think our rural services, particularly in market towns and villages, are severely affected by the decline in health services, and whether it's dentistry, whether it's lack of local hospital services, we need urgent action to address this, and I'd welcome the Minister addressing the specific points I've raised. Thank you, Chair.
Mohammed Yazin, you have 1 minute.
Thank you very much. Mr. Chairman, you said you will surprise me, and you really did. It's a pleasure to serve under your chairmanship, and like many other areas, Bedford residents are really suffering when it comes to GP appointments or the dentist appointments. So some of the reasons we have that my constituents are struggling, because we've got shortages of GPs. We are trying to recruit from other countries, but we need local GPs, and I'm very pleased that the government has pledged to train more GPs locally. Data from 2021 census showed that population in each of the local authority areas covered by Bedfordshire, Luton and Milton Keynes Integrated Care Board grew much faster than average in this area, ranging from 10.9% increase in Luton and 17.7% in Bedford. The population in England only raised by 6.6% in that period. So,
I'm afraid I'm going to have to call the order because
okay.
We've run out of time, and I'm sorry that a lot of people who won't be able to get their speeches in today. And I try to promote self-regulation, and it's worth reminding ourselves of the rules of behaviour and courtesies in the House of Commons. It says, paragraph 7, even if time limits are not imposed, members should speak with reasonable brevity and be mindful of others. Brevity in debate will give other members a greater opportunity to speak and increase the chances of being called early on the next occasion on which a member seeks to speak. And as this is the first debate in Westminster Hall, I read that out because I think it's important that people should take this into account, that we have time limits, but I prefer to not have to impose them, but people have to regulate themselves. Having said that, I call the Liberal Democrat spokesman to Daisy Cooper.
Thank you, Mr Chope. It's a pleasure to serve under your chairmanship, and I would like to congratulate the Honourable Member for Norwich South on securing this very important debate. The NHS used to be the envy of the world, but it's now in crisis, and the East of England is no exception. We've heard many examples of where our health and care services are in crisis today. There's no doubt that the new government inherits a litany of broken promises from the previous Conservative government, and that is why we Liberal Democrats have put health and social care front and centre of our campaigning in recent months and years. It's why on the first day after the general election we called for an emergency budget to give the NHS and care services the money that it so desperately needs, and it is why we now continue to urge the government to act with real ambition and urgency on some of these issues. On a debate on healthcare in the East of England, it is hardly surprising that dentistry comes out as the #1 issue. Dentistry is in an appalling state across the country, but particularly in the East of England. But arguably, it's one of those areas that is the easiest to fix. Under the previous government, we ended up in an absurd position where we had children having their teeth removed, people desperate for appointments, and yet a £400 million underspend in one financial year in the Conservatives. We also have thousands of dentists in this country who are willing to deliver NHS work, but they can't because the contract is so convoluted. So I'd like to ask the Minister if she could please outline what is the government's timeline for negotiations with dentists on fixing the broken dental contract, and specifically a request from the Honourable Member for North Norfolk, who couldn't be here, about whether it could be made faster for people who want to operate NHS services. Would it could be faster for them to register those services because there are delays in the system? Mr Chair, a number of colleagues spoke today about the challenges with ambulance waiting times. The Honourable Member for Norwich South and I have spoken in debates on this before, and he will know, as I do, that the East of England Ambulance Service has had a very troubled history. But I think to give credit where credit is due, there have been improvements in the last 18 months, and that is very welcome to see. But there is no doubt that there are still huge delays in ambulance response times, which are very concerning to our constituents. I would therefore ask the Minister whether she would support a bill which I tabled in the previous Parliament to introduce localised reporting on ambulance response times, so we can see response times on a postcode basis. Thirdly, Mr Chair, hospitals. I'm surprised there hasn't been more talk about hospitals today. There we know that from the last government there is a legacy of crumbling hospitals right across our region. One in Kings Lynn, for example, is one of the worst in the country, being held up by stilts. But in my area, in West Hertfordshire, we have West Hertfordshire Hospital Trust, and the Watford General Hospital is in dire need of a new hospital. It is one of the hospitals in the country that is ready to go. It has the land, it has permission, it has the plans, it just needs the green light from the government. And I would urge Labour ministers to recognise that delaying these plans do not come without a cost, because the repair bill is getting bigger and bigger.
And finally, Mr Chair, on GPs, will the Minister recognise that we do need to have an ambitious plan of recruiting 8,000 GPs? The last government promised 6,000 and failed to deliver them. Would she agree that we should align the primary care estate strategy with the shift to community care? And will she agree the Labour government will actually review, as part of its consultation on the National Planning Policy Framework, it will make sure that infrastructure comes first, so that places like Wixham's and others are no longer let down by a planning system, which we had under the Conservatives, where you get housing without infrastructure, without GPs and dentists. Thank you, Mr Chair.
Dr. Ben Spencer.
Thank you, Sir Christopher Trope, and it's a pleasure to serve under your chairmanship today. And I thank you again on your comments regarding self-regulation. I think for the first Westminster Hall debate of this parliamentary term, especially on healthcare, I think self-regulation is a good spirit to get started on. I'm so pleased, and I'd like to thank the member for Norwich South for bringing forward this debate, and his speech, which was a tour de force, I think, particularly a wide-ranging speech reflecting on socialist history, and it's quite clear on the topics that he's covered and his history of advocating for his constituents over the years, his deep-seated passion for delivering high-quality health services for his constituents, particularly hit the cross-party campaign regarding a new dental school, and his very precise question to the Minister, which I look forward to hearing her response. Perhaps one which particularly piqued my interest was in service of whom and to what end, particularly with reference to his points of the NHS being the greatest socialist achievement or representation of socialism in modern day. Dare I say, I believe the NHS exists to serve the people, but the state does not exist to serve the NHS. I was pleased to hear the speech from the member from Broughton and Fakenham, particularly focused on the importance of productivity and delivery of results to our constituents that are tangible and that they can see, and his support for the dental school. And he was right to point out the challenges of the Queen Elizabeth Hospital and the rebuild programme, which I'll come to again briefly. I enjoyed the speech from the new member for Lowestoft, again raising concerns around the James Paget Centre and dental care, and the speech from the member for Mid Bedfordshire, his campaign for a new GP surgery in Wixham, which he is a very strong advocate for, and in his important comments on accountability of ICSs. And naturally, I can't cover all speeches today, but dentistry and delivery were themes. And look, all of us here today are here because as re-elected and newly elected members of Parliament, we are passionate about delivering health services for our constituents. We want success in that, both for our constituency and across the UK. Now, in some ways, I think the Minister's speech is a bit easier than mine. And obviously, while I wish I was on the other side to be able to deliver it, obviously not in the Labour Party, but on the other side to deliver it, I can anticipate that she's going to start off by saying that in some way, shape or form the economy is broken or there's huge financial pressures, etc. She'll probably go on to say that NHS is inverted commas, broken, which I'm quite concerned about that language, particularly around the morale of our NHS staff workers when these statements are made. And then she's going to come on to describe her plans. And that's what I really feel for her, because she's going to be very pleasant, she's going to be very supportive. I know she's passionate about the subject, and she recognises a very similar speech that she gave to the former minister back in 2022 when she was in a debate on dentistry. But unfortunately, she's going to be evasive about her plans, because she's on a bit of a sticky wicket. Because the Labour government have decided that they're going to review a lot of work that has already been put in terms of delivering for people in the east of England. The Hitchinbrook Hospital, at risk. Queen Elizabeth Hospital, James Paget Hospital, Watford General Hospital, West Suffolk Hospital, Cambridge Cancer Research Hospital, across many other projects across the UK which are currently under review, with all the work that's gone into them over the years. So today, can she, because it is on her, because that's how the accountability to ICSs work in our system now, following the Health and Social Care Act, we are accountable to our constituents, but ICSs are accountable to her. can she today confirm and reassure our constituents, reassure all the people who have put the work into developing these programmes, that they will be delivered as was promised under previous Conservative government? And can she think again about supporting dental vans coming out and dealing with, on the temporary basis, some of the challenges that we have around dentistry going forward? Thank you.
Yeah.
Minister.
Christopher, it's a pleasure to serve under your chairmanship, and I'll try not to be too evasive, and I'll try to be pleasant. And on the latter point, the Honourable Gentleman might want to look back at some of my speeches during the passage of the Health and Social Care Act, and accountability is writ large through that. We may disagree about actually how that forms. The last government had an opportunity to resolve some of these issues, and it did not take it, having destroyed the accountability and indeed the foundations of the health service with the disastrous Lansley Act, which propelled me into coming into this place. It is a pleasure to be here on this first debate. I thank the Honourable Member for Norwich South for securing this debate. With my officials, I said it will be busy. Some of the people in this room and some people who have left are already my most frequent corresponders because of the state of the NHS more broadly, but also particularly in the east of England. Getting the NHS back on its feet is going to be an enormous challenge. But we do have the skill, the motivation and the commitment of our staff, and this government will be unwavering in our support for the NHS staff, and we will do what is needed to get it back on its feet. And that is why we are committed to a 10-year plan, because that is what it's going to take. We will deliver an NHS that is fit for the future, because that's what we promised the British people at the election, and that's what we were elected to do. I will.
I'm very grateful for the lady giving way. She says that she's going to deliver an NHS plan for the next 10 years. Does that include a full rebuild of the Queen Elizabeth Hospital and the James Paget?
I will come on to those, although people will appreciate that we're back in the early days of coming back very soon, and we will come back to people who may do a bit of lifting in some of these things, and I apologise for that, but we want to be very clear and very honest with both members of Parliament and the British people. We want to move the health service from treatment to prevention, which has been raised here today, from hospital to home, very important, I think, in the east of England with some of those rural issues, and from analogue to digital. And as a first step, my right honourable friend, the Secretary of State, has asked Lord Darcy to give us a raw and frank assessment of the state of the NHS, and the debates and some of the work that honourable members are doing will inform that. We will also launch an extensive engagement exercise with the public, with staff and stakeholders this autumn to inform the plan. Now, I've got at least 8 questions from the honourable members from Norwich South and a number of others, so I'm going to do my best in the next 8 minutes to get through them, but I will, of course, respond to people if people want to come back to me on anything that I don't pick up. The honourable gentleman from Norwich South particularly talked about prevention. He touched on climate change, dentistry and mental health, which are clearly key to many people here. Prevention is a key part of both our health mission and the mission of this government across all departments. And we want to support people to stay healthier for longer. I think the honourable gentleman said that we want the security of good health. That's what the NHS was set up to do, so people can lead fulfilling lives. Promoting greater independence and shortening the time that people spend in ill health, something we've not touched upon much, but that is a critical target for this government. The NHS Health Check aims to prevent heart disease, stroke, diabetes and kidney disease and some cases of dementia among adults between 40 and 74 years of age. And thanks to the hard work of NHS staff, the programme does engage over 1 million people and prevents around 400 heart attacks or strokes. But take-up of the health check is low. Honourable members can perhaps encourage constituents to take part. We want to improve access to that and develop a new digital NHS health check service that people can use at home. And we've now launched the next phase to develop the service, of which Norfolk County Council, I'm pleased to say, has been selected one of the 3 pilot sites due to start in 2025. Now, honourable members are right to raise access to dentists as a pressing issue facing patients. We all know that before the election campaign, and that is why it's a core part of our commitment to the British public. Only 40% of adults saw a NHS dentist in the last 2 years. The member for Luton North and Lowestoft in particular highlighted what we've all seen when we visit primary schools, and particularly look at young people and oral health. You've all read the manifesto, you know what our plans are. And just to be very clear, the Secretary of State and my honourable friend, the Minister, Minister Kinnock, have met with the British Dental Association immediately on taking office and are meeting with them regularly to resolve the issues with the contract. We will provide those 700,000 more urgent dental appointments and recruit new dentists to areas that need them most. And we will rebuild dentistry for the longer term by reforming that contract. I can't, I'm afraid, go into too much detail on the proposal from UEA. UEA is a place close to my heart. It's where I went almost exactly 40 years ago to university, where I did in fact fall in love and get married, but sadly had to leave the east of England. It's a fantastic hospital there. I know it's supported by the local ICB, and I understand individual members are seeking to meet with Minister Kinnock, and I hope we will be able to update members on that shortly. The Honourable Member for Norwich South talked about the dire state of the mental health service and the Norfolk and Suffolk NHS Foundation Trust. Just to update members here, who mostly will know that the trust into the recovery support programme in July 2021, after the CQC's inspection report requires improvement. And to address the quality and safety, the trust has implemented and completed a range of actions from that inspection report. In July, it published the Learning from Deaths report, which was commissioned by the Chief Executive to review every death that occurred from April 2019 to October 2023. And to improve that culture, the Trust has launched Listening into Action. It's a trust-wide programme to improve how staff work together and listen to each other. And in April, NHS England formally agreed a revised timeline for the Trust to exit the recovery support programme at the end of 2024, and transition planning for post-exit has commenced. Obviously, we will be paying attention to that very closely with them, and I know honourable members will also be doing that. With regard to the concern of our hospital buildings, again, we are all in no doubt about the inheritance that we have received, particularly around capital, from the last government and the state of our hospital estate. Each trust with a hospital with RAC issues has invested significant levels of NHS capital to mitigate any safety risks. The safety of our patients must always come first. It is clear that the last government's promise to deliver 40 new hospitals 2030 was not achievable, and it did not have the funding required to deliver it. So that is why we're reviewing the programme to put it on a sustainable footing, which means a realistic timetable for delivery and clarity of funding. We will be honest with the British people and transparent about what we can deliver, and we will update the House and honourable members on the programme's next steps as soon as we can. The honourable gentleman touched on climate change. This is a really big issue for the east of England. I won't have time to perhaps go into some of those issues, but personally, and as far as the government is concerned, the impact of climate change on health and the provision of health service is a serious issue. Surges in demand for services during periods of extreme weather, heat-related disruption to utilities, for example, power outages, we are cognizant of those, and I do think it is an important issue for the health service. The NHS is doing well about becoming a system on target to reach net zero by 2040, and all trusts do have targets, and that is something that we will watch very closely. In terms of rapid fire on, we're not going to look at changing structures. We want to work with the system that we've inherited. It has to try and work. It has to bring people together. It has to bring services into neighbourhood services. We've talked about the contract as well. Local services, we are keen to work together within the ICB structure. We all know in our own areas that geographies are never quite perfect, but we do not want to have another reorganisation happening. We think that detracts from what we need to get on with. I'll just pick up on the productivity issue that was raised. I think by the member for Broadland and Fakenham as well. I do think that is an issue. The concern around what you measure and how you measure it, that we want to make sure that every taxpayer's pound is used well and used properly within the NHS. Part of the issue is the breaking of the foundations of the system locally has meant it is very difficult for the service to deliver, and that is why we are looking at this on a 10-year basis. The foundations need fixing. So let me finish by once again thanking colleagues for bringing their own insights into health and care in the East of England, particularly many new members who have come here from all parties today. These are important debates. They're important for ministers such as myself to hear that directly from your constituents. Many of the issues are those that are symptomatic of an NHS that is broken. That is why we're ending the sticking plaster politics. And as the Prime Minister said a week ago, that is worth doing. It's going to be harder and it takes more time. We are not going to give deadlines that we cannot meet in debates such as this. But in just about the 2 months almost that I've been in this role, I hope that we've been able to give answers today that show we understand the scale of the issues that we face, that this government is committed to tackling them. And as I said, if I've missed anything in particular that honourable members have raised or people haven't had a chance to raise, then I will, of course, correspond with them. Thank you.
Clive Lewis.
Thank you very much, Mr. Chair. Thank you for everyone that's taken part, those that could speak, those that couldn't. I was hoping...
Order.
Thank you.
We now go straight on to the next debate, and I call Tony Antonin-Artier to move the motion.
Karen?
Yeah, is that right?
I can't believe it. Just sat over there for 10 minutes.
Can people please remove themselves if they don't wish to participate in this next debate so that we can get it going?